Hello, I am Dr. Bal Nandra, Medical Director of IV Solution Centers based in Chicago, and I want to tell you about ketamine, which has been called the greatest advancement in mental health in over 50 years. Ketamine is a synthetic drug and was FDA approved for human use in 1970 as an anesthesia drug. It is also used in the emergency room and on the battlefield to safely sedate injured soldiers and to treat their pain. It is better and safer than morphine for this because it doesn't affect breathing. In the early 2000s at Yale University, ketamine was discovered to rapidly relieve depression and elevate mood during a clinical study. Since then, ketamine has been extensively researched by many institutions such as the National Institutes of Mental Health, Yale, and Harvard. It is 70 to 80% effective against treatment-resistant depression, or TRD, which is depression that has failed treatment with 2 or more different classes of antidepressant drugs taken for about 6 weeks. Ketamine is a Schedule III drug, which makes it low on the scale of addiction. It does not cause physical addiction, and there are no withdrawals. So how does ketamine work? Ketamine blocks the brain's NMDA receptor and increases levels of the neurotransmitter glutamate, which often relieves depression rapidly. Ketamine is also a powerful anti-inflammatory agent in the brain. And lastly, ketamine is a potent activator of growth factors in the brain, such as BDNF. And in imaging studies, it has been shown to stimulate nerve growth or neurogenesis in as little as 24 hours. This is important for the long-lasting effects of ketamine, which persist long after the drug has been cleared from your brain and body. So ketamine literally causes a reboot in your brain, like rebooting your computer, and that's why its effects last for weeks or even months. What conditions can ketamine treat? In addition to major depression, ketamine can also be used to treat anxiety, PTSD, OCD, bipolar, chronic pain, neuropathy, and even migraine headaches. How do you get ketamine treatment from IV Solution Centers? If you think ketamine may help you, please discuss it with your psychiatrist or mental health provider. Although a referral is not required, we prefer to involve your providers in your care. You can also contact us and we can screen you to determine if ketamine is a good option. What is the treatment experience like for depression and mental illness? After careful evaluation, you will undergo 6 IV intravenous infusions of ketamine. Each will be about 45 minutes long with a 20-minute recovery period. Upon arrival at an IV solution clinic, one of our skilled nurses will carefully start your IV. The doctor will then assess you and will begin the treatment. Your blood pressure and heart rate are monitored throughout, and we encourage that you bring headphones with relaxing music. Our private and quiet treatment rooms, comfortable recliners, pillows, blankets, and eye masks will assure a pleasant experience. You will have these 6 treatments over 2 or 3 weeks and will then enter the maintenance phase where you will get a periodic booster maintenance treatment. What are the side effects? Ketamine is a psychoactive drug and causes what we call dissociation. This is like being in a dreamy or out-of-body state and is usually tolerated well. There is also a small risk of nausea, drowsiness, and increased blood pressure and heart rate. We can treat these as needed. So, if you're interested in ketamine treatments to conquer your depression, anxiety, PTSD, or chronic pain, please contact us and let us help you get on the path to healing, recovery, and a new life.